Hello, host. Can you please update the Ministry of Ayush from attendees to panelists? Or host, can you please make me co-host or host?
Evening, everyone. We are slightly delayed because there are some challenges being faced by participants as well as the panelists for joining in, especially through WebEx. I know most of us are more used to Zoom than WebEx. We're just trying to sort that out. Give us about 4 to 5 more minutes. Take care of this. Good evening, everyone. I think the issues are more or less resolved, and I'd like to welcome you all today for this webinar on long COVID, Ayurveda and its benefits. I'll request all the panelists who are able to switch on their cameras to kindly switch on their cameras. Thank you so much. Thank you, Dr. Rajiv Rai, for joining us.
Thank you, sir. Thank you.
Thank you, Shri Arvind Varchaswiji, for joining us. Indeed, a pleasure to have you with us.
Thank you. Thank you, Vivek. Thank you.
We have Dr. Rajgopal, Dr. S. Rajgopal, Associate Professor and Head, All India Institute of Ayurveda, Ministry of Ayush. Thank you, Dr. Rajgopalji, for joining us. We have Dr. Anand Gudiwada, Advisor, Ayush, Ministry of Ayush, Government of India. Thank you very much, Dr. Gudiwada, for joining us. Sir, we can't hear you because you are muted.
Are you able to hear me, sir?
Yeah, now we can hear you, sir.
Pradeep sir, namaskar. Pradeep sir, namaskar. Sir, I take 1 minute from all the respected panelists and all the other people who are watching our webinar. I want to introduce my successor, Dr. Kaustuba Upadhyaya. He is Dr. Kaustuba Upadhyaya. Sir, he has assumed the charge of Advisor Ayurveda Drug Policy Section, Lab and Pharmacopoeias, and apart from that, he will be looking after some portion of the National Ayush Mission, sir, NAM.
Welcome, sir. We welcome you on behalf of full industry, sir.
Thank you. So we are
Warm welcome to you, Dr. Kaustubh. Good evening, President. Warm welcome to you, sir. Thank you for joining us for the webinar.
Good evening to everyone. Good evening.
We were slightly delayed because of slight complexities of WebEx this time because our Zoom slot was already working on something else. So with your permission and the permission of the chair, sir, shall we start?
So please go ahead.
So a very good very good evening to once again to everyone. And while we would not like to hear the word COVID anymore, all of us are getting into an era without masks. So there are no fines on masks. Yet there is something called as long COVID, about which we would be discussing in detail today. And for that, Ayurveda has a great and a very important role to play. So to kickstart the evening, I'll request the President of PhD Chamber of Commerce and Industry and Chairman Multani Pharmaceuticals Limited, Mr. Pradeep Multani, to kindly give his presidential remarks. Over to you, sir.
Thank you, Mr. Vivek Sehgal. A very good evening to everyone. On behalf of PhD Chamber, I would like to welcome our chief guest, Dr. Anand Gudiwada, Advisor Ayurveda, Ministry of Ayush, Government of India, and guest of honor, Professor Rabindra Acharya, Director General, Central Council for Research in Ayurvedic Sciences, CCRS, Ministry of Ayush, Government of India, and a special guest, Padma Bhushan and Padma Shri, Vaidya Devendra Trigunaji, patron of Amam and President of All India Ayurvedic Congress and Ayurveda Mahasammelan. I would also like to welcome our today's eminent speakers for the discussion, Shri Arvind Varchaswi, Managing Director, Shri Tattva, Dr. S. Rajagopala, Associate Professor and Head, All India Institute of Ayurveda, Ministry of Ayush, Government of India. We are also joined today by Dr. Rajiv Rai, Chair, Ayush Committee and Head Research, Dabur India Limited, and Dr. Santosh Joshi, Co-Chair, Ayush Committee and Senior General Manager, R&D, Hamdard Laboratories India, and today's session moderator, Mr. Vivek Sehgal, Assistant Secretary General, PhD Chambers. Ladies and gentlemen, The Chamber has been working as a catalyst for the promotion of Indian industry, trade and entrepreneurship for the past 117 years. It is a forward-looking, proactive and dynamic pan-India apex organization. As a partner in progress with industry and government, PhD Chamber with a special focus on SMEs and large companies reaches out to more than 150,000 businesses. It works at the grassroots level with strong national and international linkages for propelling progress, harmony, and integrated development of the Indian economy. The key objective in long-term COVID management is to identify and proactively manage complications and support patients through the recovery phase with the goal of preserving their health status. It is necessary to formulate proper treatment protocol for these patients to help them restore physical and respiratory function and to reduce anxiety and depression, particularly patients with comorbidities, to restore a good quality of life. Ayurveda has enough potential and possibilities both for the prevention and treatment of long-term COVID. This is the reason why, after recovery from the acute phase of the disease, many patients seek for Ayurveda treatment for long-term lingering side effects. Clinical trials carried out in the past 1 year on the management of COVID-19 has reported that Ayurveda management is beneficial in mild to moderate cases of COVID-19 without long-term lingering symptoms, especially as an add-on treatment. This further indicates that even if Ayurveda treatment is taken along with modern medicine in the acute stage, then side effects may be reduced and there may not be any long-term residual symptoms. Findings of one of the study report that an integrative strategy for hospitalized patients which uses Ayurveda management strategies is expected to improve the treatment outcome and minimize risk. Some of the most common symptoms of post-COVID-19 condition include shortness of breath, cognitive dysfunction, which people call brain fog, as well as fatigue. However, there have been more than 200 symptoms that actually have been reported in patients. The other symptoms that patients or people may experience include things such as chest pain, such as trouble speaking. Some have described anxiety or depression, muscle aches, fever, loss of smell, loss of taste, etc. If I may share my own experience, I had a big problem with my PSA levels. What was the reason for that? I do not know. Was it I did not have COVID, but had COVID vaccination? My PSA levels had gone haywire, and I was told that maybe it is the side effect of the vaccinations or something. The current COVID-19 pandemic, along with post-COVID syndrome, has raised many questions to the medical fraternity, for which Ayurveda can be the solution in regard to its prevention and treatment. The Ayurvedic fundamental principles, if applied as per the disease condition, can certainly prevent the disease at the very first stage. The treatment plans, as suggested by Ayush, having an immune modulatory effect, can certainly combat the disease. The Rasayan therapy and the common yoga protocol mentioned by the Ayush is an important tool in dealing with the management of post-COVID syndrome. On behalf of PHD Chamber, I once again welcome you all and seek your active participation on this important discussion. Thank you, Jai Hind, and God bless us all.
Thank you. Thank you so much, President, for those very important and opening remarks, as well as the presidential address. I'm sure the evening will talk about the long COVID and the benefits which Ayurveda can provide on it to our viewers, and all of them are very, very impatient to listen to our, not only the industry speakers, but also the government speakers. May I now request Dr. Rajiv Rai, Chair Ayush Committee and Head Research, Dabur India Limited, to kindly give an industry perspective.
So thank you, Vivek ji, and on behalf of Ayush Chair of the PhD, I welcome all the participants, panelists, and eminent speaker of the today's webinar. And I especially welcome Anand Bas, Arvind ji, Multani ji, Param Adrani Triguda ji, and other panelists, Dr. Raja Gopala. So we are here to discuss about the long COVID. And we all know, and most of the people know that even after being negative from the COVID, we are still having many of the symptoms, and these are not going to be in one of the person who is getting negative from the COVID. Some of them may be present in few of the person, and some others may be in others also. So very common symptoms are like fatigue, numbness in the feet, and loss of hair, breathlessness, stress, anxiety, joint pain, numbness in the feet, as I already told, and joint pain is there. And skin rashes are there very commonly. Skin rashes are getting there to the patient who are getting negative from the COVID. So these are the symptoms which are very commonly found in the patient who are getting negative, and these symptoms persist in them for the months. And as told by Multani ji also, I also personally felt the symptoms like rashes on the skin and the fatigue and breathlessness, joint pain. So these were the symptoms. And even I have felt the brain fog too, which was there with me for the months. So these are very common symptoms, and I think Ayurveda has a lot of options to overcome with these kind of problems, especially by getting the proper ahar, pranayam, and rasayana therapy. We can do the restoration of our body and mind, especially the restoration of the body and mind, which is derailed by the effect of the COVID virus is there. So we have to restore the original pathway of our body and mind, and by restoring the pathway, we can channelize the things once again on the right track. So Ayurveda has a lot of things, and by providing the proper guideline and giving the proper nutritional diets and the rasayana therapy. So industry role will be there by providing the proper rasayana supplement and rasayana option to the patients, by which they can rejuvenate themselves, and they can certainly reduce the long COVID period by significant days, so that they can have the lesser impact of the long COVID period. So I would like to especially thank to the PhD staff here, who are taking a lot of pain for organizing these kind of relevant seminars. And I will like to welcome Dr. Upadhyay ji, who is going to join, or already joined as an advisor for his new role and responsibility from industry forum. I'm welcoming him, and from the Ayush chair also of the PhD, I welcoming him, and hope the panelist and the eminent speaker of today's webinar will discuss all these things very seriously, and they will guide the path to the attendees who are here in good number, and they will certainly get help from our today's discussion. So thanks again to all the staff, and welcome to all the panelists and eminent speakers. Thank you, sir.
Thank you. Thank you so much, Dr. Rajiv Rai, for your industry perspective and also your personal experience. Just like the president discussed, you had something called as fogging of the mind. And of course, a lot of these other side effects, or if you want to call it long COVID, which is kind of gaining prominence post the COVID era. Time for me to invite our chief guest, Dr. Anand Gudivada, advisor Ayush in the Ministry of Ayush, Government of India. And at this point of time, let me also welcome once again Dr. Upadhyay, who would be actually taking up the role as informed to us by Dr. Gudivada. Over to you, Dr. Gudivada.
Thanks, sir. Thank you very much for giving the opportunity to participate in this long COVID. And almost all the things that are required is told by Pradeep sir as well as Rajiv Rai ji. And I want to tell my experience on this topic, that in Ayurveda, they have specifically told that don't run behind the infection. Which was I never believed in my life. Now I am realizing that probably the authors of the Ayurvedic books, they might have seen many COVID-like situations in their lifetime, and after that they thought that the only infection is not the reason, but to carry the diseases, there should be some other factors which actually play the role in the body. So what they propagated is, after infection, there is a possibility of disturbing of the harmony of the body, especially the component doshas. So when they vitiate, they will cause further diseases into the body. This is what now I am experiencing and I am noticing. Pradeep sir has told regarding prostatic infections related problem. Then Rai sir has told about brain fogging. I want to add some more things. People who never had raised blood sugar levels, they have got raised blood sugar levels. People who don't have any problem with the vision, they have got changes in their vision. And people who don't have any memory loss, any disturbances, they started noticing the memory loss and disturbances. So like this, there are so many different type of disease conditions they are day to day I have encountered in my clinical life, which have nothing to do with their routine type of life, where they were never experienced such disturbances. Even including hypertension, BP, there was rise in the BP. In young people, around 35 years age, 40 years age, I noticed there is variation in the blood pressure recordings, countings. So all these things definitely tell us that what the Ayurvedic system has told is not false, it is true. So looking into that perspective, from that point of angle, I want to suggest that the best way to manage the long COVID is the basic principles that were incorporated in our Ayurvedic sciences, like Ahara, Nidra, Brahmacharya. Regarding Ahara, Rai sir has told something and I want to add some more thing. We have to look the Ahara prospect not from the view of the proteins or minerals or vitamins. We have to look it from the point of view of the rasa importance. Shadrasa Yukta Ahar. Ayurveda has told that if a person wants to have a good immunity, he should eat and he should use as much as possible all the 6 types of rasas food in his food habit. And like that, if a man wants to build up the immunity levels, he should have minimum levels of sleep, nidra. I was seeing the news 2 days back and I noticed that in South Korea, they spend around 18,760 billion rupees of medicines to get the sleep. They are disturbed with the sleep. And brahmacharya means here not the thing what we generally think. Brahma means the experiencing towards knowledge. Charya means participating into it. Means somewhere it related to the lifestyle disorders also. Means the lifestyle, if we don't maintain properly, it will definitely hamper immunity, and that hampering of the immunity will cause the diseases in the body. So with these perspectives, I want to take forward these today's discussions, and I request the panelists and the eminent speakers to carry forward the discussion, sir. Thank you.
Thank you. Thank you so much, Dr. Guriwara. I think real pearls of wisdom coming from the Ministry of Ayush and giving us a deeper insight into, unexpected, as you said, and unexpected, after effects of COVID. May I kindly invite Dr. Kastup Upadhyay ji also to say a few words, please.
Generally, post-COVID diabetic infections are too many. Daily, we are getting 2 or 3 cases in dispensary level who are not having COVID before onset of COVID, but after onset of COVID, whether positive or after vaccination, they are reporting high sugar levels. And many of them are not responding to our routine medicines, routine medications. And in Shastra, we say, Yatra Sangaha Kavaigunya. So Kavaigunya is the main reason which is caused by this COVID infection, what I feel. And Dhatugata infection is there, and we have to treat for a long time with the perspective of improving Rasagni. Rasagni improvement is very much necessary in treating all the infections which are part of long COVID. So we have to concentrate on that, and whatever Jwarahara treatments, they have to be continued even after the symptoms have receded, because see, Tikta Rasa is the Pradhana Dravya in Jwara, and Tikkarasa has a major role in treating all these disorders which are long COVID in long COVID group. So
Thank you, Dr. Upadhyay, for adding on to this and reaffirming the fact that Ayurveda can handle what we call as long COVID. Time for me to invite Professor Rabindra Narayan Acharya, Director General, CCRAS, Ministry of Ayush, who's our guest of honor today, to kindly share his thoughts for the evening. Over to you, Professor Acharya.
Namaste.
Namaskar, Professor Acharya.
Vachashiji, Namaste, Arvindji, and other Gudivadaji, and all other learned members of this group. I thank the organizer for inviting me to join this learned group for the first time. And I know about the activities, all these things of the group, but I am joining here for the first time in this interaction, and particularly the COVID management. The issue today's debate topic is COVID management, post-COVID management, and though I have a little experience in clinical experience because I am a pharmacologist by profession. Ayurvedic I am not much exposed clinical exposure patients in that, but what we found, and this issue was raised by me when this COVID was started. Ministry started discussion. When I have gone through the papers, research papers of respiratory disorders previously studied, and before when the COVID was started in 19 and ministry started discussion, at that point of time, I found more than 10 to 15 research papers of post-COVID, pandemic situations, what arrived, but that disease, and that point of time also I have highlighted that point in the ministerial discussion, and particularly the psychological conditions, what the people are feeling. I have come across 2 to 3 patients in that aspect also. Due to the phobia of infection, what the people are now facing, that they are avoiding everything touching the different articles and all these things they are managed. So in these conditions, we need some. We are working in Ayurveda in our what I have after joining CCRS, I have found that some projects are also in that post-COVID management of that disease conditions, with psychological conditions. So hope I will be here in this discussion because I have not come prepared with all these presentations, all these things. So let me hear the views of others, and hope CCRS will be in collaborative mode and other research purposes. I know we have some research project going on by submitted by different pharma companies. I was in touch with Arvindji before joining CCRS. The activities I saw that many companies are coming up for COVID research. But my point of concern to say with a sincere, I can say sincerely, I can say that we have to come across the rigorous nature of the clinical. We know that yes, many companies are coming forward this pandemic situation and with very limited sale and benefit ratio, but they are coming up with for social nature or for what I can say, so social service sector also they are doing this thing. But in the CCRS perspective, I can say when we are inviting the experts, none of the CCRS persons are involved in that expertise group, sir. And this is totally third party evaluation where the chairman is from a retired scientist of AIMS New Delhi or some retired scientist of different organizations. They are prospecting, they are seeing the observations, clinical study results in that category of research, what they did, particularly drug research in clinical trials of synthetic drugs. But in many cases, we are not reaching the status of what they desire for a clinical study to be approved by she said the parameters what they find. So my sincere suggestion, whatever, and we are doing, no doubt, our data is robust, our study, but the presentation and some lacunas in the chemical investigations are there. That's why that studies, they are putting repeated observations, repeated remarks on certain parameters. So my suggestion would be that yes, let us learn from this and hope our studies should be presented in that aspect, particularly vigorous the scientific vigor of the study should be maintained. With these remarks, I thank again for giving me the opportunity.
Thank you so much, Professor Acharya. And I think you brought in a very important aspect of the after effects of COVID, which is the psychological conditions, or what we call as mental health. And that's definitely been something which has been troubling a lot of families and people. It's time for me to invite Shri Arvind Varchaswiji, Managing Director, Shri Tattva. Sir, it's always a pleasure to hear you. And your views on the long COVID, I'm sure, will definitely bring in a new and a fresh perspective. Over to you, please.
Thank you so much, Vivekji. At the outset, it's such a pleasure to be here amongst such erudite speakers. First of all, Rabinaran Acharya-ji, Anand Gudiwada-ji, Vadiyai-ji, Honorable President Pradeep Multani-ji, a very good friend of mine, Rajiv Rai-ji, and also Rajgopal-ji from Aya. It's a pleasure to be here with all of you. And in fact, if I might say that it's really nice to be in a world without COVID, at least, for some time. People are saying that one more wave might come, or, something like that, but really praying that, that the world really sees much brighter days. Having said that, I think that what COVID has really done, for us as a country is to really ponder upon that the wealth that what we have as a country in terms of our medicinal systems, our ways of living. We really need to imbibe this and make it as a part of our dinacharya. What does Ayurveda really bring across is that it really teaches us how to live a healthy and happy life. And dinacharya is very, very important. We know what things we need to eat. We know when we need to do it. But whether we do the right things at the right time, that's the big question. So having said this, from Rishi Tattva's side, we've seen that, in the first wave, we also saw that we had one of our medicines repurposed, one of our Siddha preparations, Kavasarupatini, repurposed as a medicine for COVID-19 management. Then later we went across and we also championed the aspect of Ayush 64 along with the ministry. And also now we've also seen that we are submitting and, putting across more data onto one more medicine that what we are researching for COVID. So that's also happening, and we've also submitted that into the ministry as well. So what does this really signify, as what Rabinaran Acharya-ji also mentioned, that this particular wave has really shown us that even the Ayush industry can come out with robust clinical trials and also see that medicines are repurposed for COVID-19 management. So I feel that, as industry, we also need to bring across, an aspect of robust research and development. For example, our new medicine, we've seen that we are doing 8 different trials in 8 different, places, and that too in all in allopathic hospitals. So what we would really like to do is that we'd like to break away from this prejudice that is there against the entire science. While we do understand that a whole lot of things that we do bring across on the aspect of scientific temperament. At the same time, like what Rabinaran Acharya-ji also mentioned, is that the government also, helps industry to see that they bring across more robust mechanisms. And this is something that is very welcome. And I feel that this is the way to go forward, that where both the industry and government work together, and especially see that how we could bring this entire sector across, up and running onto a different level. One particular thing is that we also need to understand that the ministry is also the youngest ministry, the industry is also the youngest industry here. So we also need to see that the ministry over here, being the government, also hand-sold industry to see that how we could really take things forward on this particular aspect. Coming across to how COVID-19 has really brought a different mindset or a different perspective towards healthcare, is that people have realized that it is no more allopathy versus Ayurveda versus homeopathy versus Siddha, but bringing all these systems of medicine together and seeing that what's relevant at that particular point in time in that person's life. So whether, when it comes to critical care and accidental care, nothing to beat allopathy, but when it comes to lifestyle disorders and also answers that what allopathy does not have, and certainly we've seen that even for COVID, no system really has an answer for that. But in the Ayush system, we are seeing that how we could help modulate immunity and also keep our immunity system up, and that being the answer to see that how we could actually see that we sail through COVID in a much more healthier fashion. So I think that this preventive healthcare and also the aspect of championing our products, services, and also the aspect of dinacharya. How do I live healthy? How do I stay healthy? How do I maintain my health? I think these are all answers that what are relevant to be answered, especially during this long COVID time. We've seen that all people from all walks of life came together and really championed the cause of Ayurveda, Siddha, during these waves. And this is very, very encouraging. What does it mean? It shows that the customer, the consumer is educated. They know what they would want in their life, and everybody wants to be healthy. People want to live as natural way as possible. People would like to see that they imbibe a more futuristic and holistic lifestyle. I think these are keywords that what go across a very long way. One more statistic that what I would like to mention to you, that during the waves of the COVID, this particular aspect, the keywords of meditation was most searched upon, and Gurudev Sri Sri Ravi Shankarji's meditations were global #1 and #3 searched during the during the first and second and third waves. What does this signify? People really want mental health also, and that's something that what the Ayush systems can really champion. While no other system of medicine talks about mental health equally that of physical health, and this is where yoga, meditation, and also Ayurveda helps to see that how your body can rejuvenate itself. It's no more, it's not as what even Gudivadaji mentioned, that is not symptomatic, but Ayurveda and the Ayurveda systems go to the root cause. And that's something that what's most important even during these COVID times, that you do not go only on the symptoms, but seeing that what exactly is actually happening inside your body and how can you help your body fight this particular menace. So I think that these are things that what I've really taught, and we have seen that quality of life really changes when you make Ayurveda and the Ayush systems as a part of your daily routine. And this per se, whether clinical trials or no clinical trials, we have really seen that, this is the case, worldwide. We've seen that, we've done research not only here in India, but also as far as in Germany, in Turkey, in Oslo. What does this signify? And also right now we're going to be researching in US and also in South Africa. What does this signify? People really want the Ayush systems with them. And I feel that as industry and also as ministry, we need to work together to see that how we could reach it out to people. So COVID has really taught that the Ayush systems are extremely relevant, although they're 5,000 years old. We've seen that both ministry and industry are, making them and presenting them in a way that what's still relevant even in today's, modern world. I would say that the Ayush systems are the modern medicine right now. And, this is something that what we really need to be very proud about. Thank you so much, Vivekji.
Thank you. Thank you so much, Arvindji. And as I said, it's always a pleasure listening to you and making some key points of not only the research which you're making at international level at multiple locations, but also throwing some more light when we started talking about psychological impact by focusing on meditation, which you said was probably one of the most searched words during the COVID, and how the yoga meditation and Ayurveda all put together can actually tackle the psychological or the mental health. So, and I must also talk about the preventive and the dinacharya regime, which you actually emphasized yet again in your address. So thank you, Arvindji. As I said, always a pleasure, and of course, so informative and so refreshing to hear you. May I now request Dr. S. Rajgopal, Associate Professor and Head from the All India Institute of Ayurveda, Ministry of Ayush, to kindly share his thoughts for the evening. Over to you, Dr. Rajgopal.
Namaste to all. I think I'm clearly audible.
Yes, you are. Please go ahead.
Yeah,
And
sir,
we can see your PPT as well.
too.
Yes.
Thank you, sir. Respected dignitaries, first of all, let me convey my thanks to PHD Chamber of Commerce for giving this opportunity to speak and address you all. My talk will be more of academic one because I'm from the academic background, and some of the points which I'm going to discuss, I will not highlight much because it has already been covered. More of Ayurveda concepts I'll be discussing here. Going ahead with the presentation. Sir, his slide is moving, sir?
Yes, Gopalji, it's moving.
Yeah, thank you. Thank you very much. This is the institute, of course. I did not say anything more on this. And during the second wave of COVID infection, or what you call the dreadly wave which we have faced all over India, immediately after those phase, we started our post-COVID care unit in our hospital at All India Institute of Ayurveda. And we had a good inflow with the post-COVID complications or post-COVID issues in this OPD. And later on, of course, we have merged this with our general OPDs. Even today, we are getting good number of cases with the long COVID or post-COVID issues. What is long COVID? If you see, it is COVID infection, the symptoms which develop or which continue with the COVID infection itself. It can last more than 4 weeks to 12 weeks or even more. To be very frank, we have patients or we have information about patients who are suffering for a year too. In October 2020, at the beginning of or the fag end of the first wave of COVID, I had COVID infection. And even today, I am suffering with the post-COVID issues like concentration, issues with the concentration and myalgia, pain in lower limbs. It is still there. Even if I'm taking Ayurveda, Rasayana drugs and everything, it is still continuing. That means the post-COVID issues can stand long and it troubles people for a longer time. This slide, of course, this is the right side where we can see the percentage of cases. Though it has come down, it has not become zero. Today's issue in Delhi is that the number is slightly on the higher trend. That means the fourth wave they call it is expected. Whether we don't know whether it is fourth wave or it is a third wave continuation or what it is, but the number is again it has not become normal, though all the restrictions have come down. The challenges with the COVID, what we have is, or what we had and still we have is unpredictability of the chronicity and severity of the complaints. The lack of documented knowledge in the domain, it was in the beginning very much. We were just knowing something like a black hole. We were not knowing what COVID is. And of course, now, of course, we are becoming clear day by day. And the third challenge, what is the novel symptomatology or the newer trends? The EX trend, what has been postulated or expected, ICMR, though it has denied the first case which was reported in Bombay, we don't know. The symptomatology, novel changes taking place. These are challenges we are facing. Along with that, of course, long COVID issues. As it was discussed by eminent speakers in this webinar, like BPH or post-COVID issues. Just a couple of days ago, we had a young boy of age around 21 years from JNU having tachycardia and cardiac issues. All these things have started post-COVID only, post-viral infection. To go ahead with this figure, of course, this I have taken from a journal where the self-reported symptoms of COVID, not from India alone, of course, it is more of United States. Coming to the symptoms, the general symptoms, if you see, The most common symptoms are fatigue, joint pain, loss of taste and smell. It can regain, but it will be long lasting. Difficulty in breathing. Those who have respiratory issues, they have definitely they face this difficulty in breathing. Chest pain, unexplained chest pains, sleep issues, brain fog, inability to concentrate. Many of them, old age people affected with COVID, they definitely come across with impaired memory also. So those who seem to be most at risk developing post-COVID syndrome, they call it a syndrome as such, is adults above the age of 50 years. For COVID also, the elderly age is dangerous. People who experience more or severe cases, individuals with underlying health conditions, particularly cardiopulmonary issues, hypertension, diabetes, obesity, or such type of metabolic issues. Dr. Lahoti is a scientist who worked extensively on this COVID infections and COVID issues, and some of his studies there say that 10% of people COVID will go to develop post-COVID syndrome, and 70% people experience persistent symptoms. This is his study observation. Coming to issues with the heart, palpitation is the most common. The same as I said, I have also come across with a child as a college student with the palpitation. Fatigue is a common symptom. Everybody is complaining of this. Chest pain and tightness in the chest, damage to heart muscles, and heart failure also rarely presented post-COVID issue. Thromboembolic risks are another issues. Pulmonary embolism, retinal manifestations, as earlier told, eye issues with the vision. Retinal manifestations, yes, we have come across with retinal manifestations. Our OPDs in the Shalakya department, we come across with this. Heart attack and stroke, though it is not reported at our place as such, but it has been reported in many studies. The lung issues includes the whole respiratory tract as a whole, sore throat, chronic dry cough, very common complaint this is, shortness of breath, exertional dyspnea, damage to lung tissues and restrictive lung failures. Of course, in this chronic dry cough is a very, very common presentation in the COVID or post-COVID presentations. In the gut, anorexia, loss of appetite, abdominal pain, unexplained abdominal pains, that is more common. Diarrhea, nausea, indigestion, bloating of abdomen. This is again another complication or another issue associated with long COVID. In the brain and nervous system, if you see, brain fog is the most common. Majority of the people complain about this. For some, it is limited to some time period, but many of them it is long-standing. Peripheral neuropathy is another issue. There was one question in the chat box also regarding peripheral neuropathy and aches and pains, unexplained aches and pains. If you go to the mental health, anxiety, depression, post-traumatic stress disorders, and sleep disturbance. Sleep disturbance is the most common which we come across. We came across in our OPDs. In the musculoskeletal myalgia and fatigueness, these are the two things. Arthralgia, joint pains are other things associated. In the skin manifestations, though many not very common, fungal infections were very common. The other things like discoloration, itching, allergic rashes, hair loss, these were reported, but fungal infections are very common in post-COVID or long COVID issues. In the ear or in the indriyas, ear, eye, nose, throat, tinnitus is most commonly complained, and otalgia, dizziness, sore throat, dry cough, conjunctivitis, retinal circulation problems, all these things are seen. Coming to the Ayurvedic view, of course, Charakacharya has very clearly told naming nomenclature of disease is not very much required, because if there is no name for the disease, you can understand the pathogenesis, you can understand the samprapti of the disease. Tatra evam upadishanti buddhimanta. That there is a line in Charaka Vimanasthana, wherein the whole pathophysiology can be understood by understanding the disease process. So it is not that COVID is not mentioned, so there is no treatment. It is not like that. There is treatment, and you can understand the COVID. And based on these guidelines of our classics or our acharyas, we have formulated or we have understood the disease process in Ayurveda terms. And we have formulated treatment also, and we are successful also. Like understanding this, the most affected srotasas in the body are pranavaha, annavaha, purishavaha, raktarasavaha, mamsastivaha, and manova srotas. These srotasas are involved, and management of this rotodushti is required. So secondary to this raktavaha srotodushti, dermatological manifestations, brahma, samjnavaha srotodushti, indriya upatapa, or indriyas, the sense organ involvement in karnanada, tinnitus, karnashula, abhishyanda, etc. So the idea is, though in the Ayurveda classic no explanation about this or this type of disease, but Based upon the symptomatology, you can correlate with the Ayurveda principles. Now, coming to the treatment, at All India Institute of Ayurveda, our post-COVID management was in lines with the Ministry of Ayush guidelines, post-COVID management protocol, which was published in 2020 September, where drug therapy is one, rehabilitation is another, diet is another important thing, and fourth one is yoga, pranayama, and recreation. Of course, recreation component is given or for mental well-being, yoga, pranayama for respiratory as well as mental well-being, diet for the physical well-being and rehabilitation for post issues. This is just a clip of the guideline given by Ministry of Ayush, wherein very specifically they have told use of Ayush Kwatha, the use of mulethi powder, the use of Chavanaprasha, gargling with haldi or turmeric with the salt. These things are mentioned. We are following the same thing. Of course, in addition to the Chavanaprasha, we might have added other rasayanas like Dashamula Rasayana or some other suitable rasayanas based upon the patient's condition. Daily practice of pranayama, yoga practices, meditation, these were add-on to the medical management. Going to the classical or theoretical description, the cornerstones of Chikitsa are sthana, dosha and avastha. Looking into the dosha, involvement of doshas, the sthana, where it has taken place, and avastha of the disease. Objectives, Vyadhikshina avastha is there because post-COVID period, patient is already undergone a very traumatic situation. And of course, Bheshajakshina has undergone management with the varieties of drugs. Langhana cannot be recommended. You cannot put patient on Langhana, as Ayurveda says always Langhana is the first line of treatment. No, that cannot be done here. What is required is Mrudu Langhana, of course, if possible, you can put, or you can use Laghu Ahar instead of going for Langhana. Laghu and Santarpana type of Aharas we can adopt. Balya and immunomodulating components in the diet and as well as medicine. The bipolarity of manifestation, you can see dosha avastha is initial first phase was Vata Kapaja in dominancy. The second wave was of Pitta Rakta in dominancy. And the third wave, what we have seen is Kapha Vata predominancy we have seen, where severity was very less. Pitta Rakta inflammatory process, severity is much more. Vata Kapha, again, unexplained severity was, conditions were there. Based on that, of course, in the prana srotas, or if adhisthana is prana, srotas is prana affected, various kashayas, churna, avaleha, rasa, gutikas, ghrita, taila, rasayana preparations we were using or we can use. In Vata Kapha dominancy and Pitta Rakta dominancy, what type of drugs can be used? It is listed here, like Dashamula for Vata Kapha and Vasa based or Tikta Rasa Pradhana Dravya based drugs for Pitta Rakta predominancy. Churnas like Sitopaladi, Talisadi can be used. Of course, Sitopaladi is more for Pitta Rakta because it is more of Pitta Shamana in nature, whereas Talisadi is Vata Kapahara in nature. Haridra Khanda is one of the trusted formulation which can be used in both the conditions. Likewise, many drugs are mentioned here: Tibunagit Rasa, Shwaskothar Rasa, Lakshmi Vilasa, Lagu Suta Mishrana, Suta Shekara Rasa, Vidaryadi Ghirta, Vasa Ghirta. And in the Rasayanas, Pipali, of course, Pipali is a very good Rasayana for upper respiratory tract as well as respiratory issues. Pushpanda Rasayana is very good for, again, respiratory issues as well as one of the best Rasayanas available for Pitta Rakta condition. Rasa and Hridaya, when it is involved, Kashayas like Indukanta Kashayam, Amrutottara Kashayam, Churnas like Talisadi, Kantakarya Valeha or Dashamula Harita Kevaleha, Dasya Harita Kevaleha, Hridayarnava Rasa particularly, Ashwagandha and Shilajato use. This can be done. And Pitta Rakta involvement, Guduchi stands first. Patoladi Gana, Drakshadi Gana, all are Pitta Shamaka in nature. This type of drugs we can use. When Sthana is Annapurishava, digestive system is involved. The drugs which are acting on digestive system and on the dosha specific like what Indukanta, Amrutottaram, Guduchadi, Patoladi, these drugs can be used. Coming to the Manovaha Srotas, when brain fog and such complaints are there, major Rasayanas are doing wonderful. And you can see Guduchi in almost all conditions in the second wave or wherever Pitta predominance is there, Guduchi can be used. On the other hand, Guduchi is one of the best Rasayanas available, which can be used in day-to-day life also. Guduchi, Shankha Pushpi, Yashti Madhu, Brahmi, etc. This type of drugs can be used in brain fog. And Indriya Vikara, when it is there, Anutailanasya, Shiro Abhyanga, Trifala Rasayana, Saptamratala, particularly for the eye, and Shiro Abhyanga for all the Urdhva Jatru Vikaras, and Untitled Anasya is again for the all Urdhva Jatru Vikaras. This can be used, and we have used successfully also. Going ahead, specific conditions, if it is the like fever and breathlessness, we have got drugs like Stalisadi Churna, Hingvachadi Churna, gut-based symptoms. If Suchi Birivan Stoda, that is numbness and peripheral neuropathy, such conditions, Sitopaladi Churnam is one of the drugs which can be used as a rasayana also. Though it is indicated in respiratory conditions, there are evidences or evidence-based studies too where Sitopaladi acts as rasayana too. Thromboembolism, such conditions, Kalamega, Guruchi, Mahatiktaka Yoga, all Tiktarasa Pradhana Dravyas. In the rehabilitation domain, yoga asanas for the physical fitness, and pranayama for the respiratory and mental fitness. Post-ventilation complications with the eyes and swallowing, if it is there again, these things are management of breathing and breathlessness management helps a lot. Attention, memory, thoughts, and mood, mental health, yogasana and pranayama are very wonderful and very helpful. Lot of patients, they come with the what you call opinion that yes, I started doing Anuloma Viloma Pranayama, simple Anuloma Viloma Pranayama, I am feeling better. The controlled breathing is one thing which will be very helpful in such conditions. Closing the eyes, focus on breathing and keeping hand on, that is controlling our breathing or feeling our breathing. This is one thing. Paced breathing is another thing. Of course, this has been taken from the present management also. Exercise is good definitely, but safe exercise or safe level of exercise is required, and right level of exercise will be beneficial. Excess will be detrimental to the health conditions. Post ventilation complications, some of them they have gone for respiratory issues and went for ventilation support also. In such things again, pranavata is involved and pranavayu dushti is seen and prana abhigata has taken place. So we have to manage this with sometimes like Vranaropana Dravyas. And in the respiratory illness, if you say Kshataja Kasa, Pushpandavaleha is mentioned in Kshataja Kasa, and Kshataja Kasa management, such type of drugs. Marma Bhigata Chikitsa to be adopted. Vatanulomana, Vatashamana, and Brahmana type of drugs like Vidarya Digrata and Pranayama. Of course, in the post-COVID management, specifically involved with the respiratory system, Pranayama plays a vital role. For the mental health, the recreation is important. Meditation prayers are very helpful. And nearly about 600 patients we have treated in the COVID ward in the All Indian Institute of Ayurveda, where what we have seen is majority of them went out with a very pleasant mood. One of the reasons was this: all of them were subjected to pranayama or exercise, yoga practice in the morning hours, as well as recreation games in the evening hours. So this type of, along with that, of course, constant counseling was given, Sattva Chikitsa was given. Coming to the role of Panchakarmas in post-long COVID, Abhyanga and Sweda plays good role. Nasya is of another thing. Basti we have not seen specifically, but Basti also, like this thing, what do you call, Brahmana type of Bastis, they will be of much help, but we have not tried this. Of course, Abhyanga Sweda definitely helpful. In the Paschat Karma Samsarjana Krama, I am not very specifically highlighting Samsarjana Krama here, but the diet control is required. Diet control in the sense good quality, nutritious diet is required. Referral indication challenges, many referral indications are there. Severe hypoxia, oxygen desaturation on exercise. This is, of course, cannot manage with the drugs. At a supportive care is required, like ventilators and oxygen supply and other things. Multi-system inflammatory diseases or multi-system inflammatory syndrome, particularly in children, if such things are there, the patient has to be referred to the higher center. And this cannot be all treatment cannot be generalized. The reason is we believe in Desha and Avastha of Desha also. We know Jangala, Anupadeshas, where Kleda is more, there the complications are more, like Klejajanya Vikara in southern part of India. Geographical and seasonal plurality is to be respected and considered while managing long COVID. So with this, of course, I think in a marathon presentation, I have done some views. The one thing what you can see here is the Swastha Raksha kit, which we All Indian Institute of Ayurveda had developed. Of course, all these things have developed, or all these things have made possible only with the help of active support of Ministry of Ayush. We have also developed one Bala Raksha kit, where children keeping childhood age into concentration. And the same kit you can see in Bala Raksha also, Ayush Kwatha was converted into a syrup form. And we have added jaggery to it, which has nutrient component also. and some Shamanavati, Anutaila, Chaunaprasha is there in the Balraksha kit also. So the approach is a composite approach. Along with that, we advise a controlled exercise, a safe and healthy diet, and healthy habits like hand washing and other things. Thank you, PhD Chamber of Commerce, for giving me an opportunity to address you all. Thank you all dignitaries and the audience for patience hearing. Thank you very much.
Thank you so much, Dr. Rajgopal, for a very, very informative and interesting presentation. And of course, all the hard work which you put together, to showcase all those facts, and of course, also letting us know what medicines can work for what different conditions. So definitely a very, very informative presentation. I have one quick question, Dr. Rajgopal, for you, because we know
Yes, sir.
all the cases which went to All India Institute of Ayurveda for during the COVID time. I think there were, what if I remember correctly, there were no deaths, and all of them came back happily home.
Yes.
So I just want to do a quick recce on the fact that we're hearing a lot of these long COVID cases. So in the follow-up on the cases who actually got treated at All India Institute of Ayurveda, have you had any case for long COVID in any form, in form of any particular condition which has been seen in the patients who have recovered from the All India Institute of Ayurveda?
Yes, sir. The most of the cases which have given follow-up is with the myalgia, muscle pains, and fatigueness. These were most of the cases we have seen. Of course, cardiac issues or respiratory, those who had earlier respiratory complaints like asthma, bronchial asthma, or COPD or such things, they had some complaints, persisting complaints. Otherwise, majority of them, of course, there was no issue.
So it was
Myalgia is one thing. Yeah, muscle pain and pain, aches and pains. These were the most common one.
No, that's quite a relief to know, because we've been hearing a lot of cases in and around in our family and friends about a lot of long COVID cases,
Yeah.
problems which were never there surfacing, and giving difficult times to patients. And but it's quite interesting to know that yes, except for the muscle pain, there weren't really any long COVID conditions
So
for the
much.
patients who have recovered from there. So thank you once again, Dr. Rajgopal, for a very informative session. And time for me to check back with the participants. I must also thank you for answering the question, which was from Dr. Lokmani Gupta from Kota during your presentation. So I don't seem to see any more questions. Dr. Ravi, can you see any questions if I'm missing out on any in the Q&A or in the chat box? Is there any questions from the audience, from the participants, from the attendees? Please feel free to put them in so that we can address them before we close the session for today. So, Dr. Ravi, did you find anything which I may be missing out on?
Sir, I don't find any question, but can I ask questions?
Oh, yes, you can also ask a question, very much.
Yeah, sir, my question is regarding, we are seeing a lot of cases of AVN post on a long COVID effect. So, is there any way from Ayurveda also that we can treat this AVN, which happens because of the COVID? Though the patients were not on the steroids or, on alcohol, but they may still have this AVN problem post COVID, which is also, you can say, long COVID because it happens after 6 to 8 months of the COVID. So, I need your suggestion on that, sir.
Is it the question to me, sir? Am I
That's
supposed
right,
to
Dr.
answer?
Rajgopal. That's to you.
Yeah. No, actually, sir, we have to see the presentation exactly, and patient to patient, the presentation may vary. Definitely, the patient AVN will get benefited with the Ayurveda management. Sometimes they may require hospitalization and panchakarma based or procedure based therapies too. Patient to patient and age of the patient, all these things are to be considered. So if at all such cases are there, you can refer to our place, and definitely we can manage. Because we have patients who have not taken Ayurveda management, but taken COVID care elsewhere, modern management or conventional management, and then they have complaints like this, and they are coming to us. They're getting benefited with in indoor management, procedure-based treatments like Abhyanga, Sweda, Basti, and other things. Yes.
Right, sir. Right, sir. Because in the allopathic one, the doctors are referring for only two treatments to AVN patients. Either
Yeah.
go for decompression therapy or you can go for total hip replacement, which is not
Yeah.
advisable on a young age. So just
Right.
wanted to know if Ayurveda can be a better help because we see a lot of AVN cases right now because of
Sir,
in a post-COVID era.
no. If I can share my clinical experience, I too have pulse disease or avian patients, not related with COVID as such. What we have seen is with Ayurveda management, the progression of the disease gets arrested. Number one, clinical symptoms vanishes, completely vanishes. Pain also disappears. But only thing is, we need a long follow-up, and treatment has to be continued for long period. So all these patients, some of the patients were pre-COVID era, they had come to us 2-year gap, and 2-year gap, they could not continue the treatments and condition worsened. And they came back again with pain and degenerative changes of the femur, all those things. And once again, we had to start the treatment right from 0-1. But still, they are getting benefited. I cannot say that completely cure or anything, but if they come in the early phase, possibly the replacement and other things can be postponed rather.
That will be a good, sir, because if the hip replacement can be postponed. So is it something like from Ayurveda treatment, the blood circulation can start again and actually the bone regrow of the bone can happen through Ayurveda treatment?
Yeah, it can definitely, sir.
Right, sir.
Only thing is debris, dead tissues are there, they have to be removed or they have to be taken off from the
Necrosis.
site, and then you have to, yes.
Right, sir. Thank you, sir.
Okay. So good question, and I think a better answer coming in from Dr. Rajgopal. So thank you once again. And I think we really don't see any more questions right now in the chat, and which gives us a feeling that it's been a very fulfilling session for all of us, taking care of all our queries and our thoughts and doubts. And since long COVID has become important, and as I think Arvind Varthaswiji said, that hopefully we don't see a fourth wave or an extended third wave, things seem to be going in the right direction. So I'd like to propose a vote of thanks, a formal vote of thanks. My heartfelt thanks to Dr. Anand Gudiwada, Advisor Ayush, the Ministry of Ayush, Government of India, who's our chief guest for today evening. Thank you very much, Dr. Gudiwada.
Thank you, sir. Thank you.
It's been a very, very nice association with PhD Chamber, and we will continue to associate with you as and wherever you are, Dr. Gudiwada.
Right.
And
I will be here, sir, for some more time. Let me make him more comfortable in this zone. Then after that only it depends on my secretary, sir, what he wants to do. Right now he is not willing to leave me.
I would think as much. And but however, if he does leave you, we may not.
Yeah.
So I'd like to thank Dr. Kaustubh Upadhyay for also joining us. So a warm welcome yet again, and we will continue to interact with you and be in touch with you. My heartfelt thanks to Professor Abhinarayan Acharya, Director General for Central Council of Research in Ayurvedic Sciences, popularly known as CCRAS, at the Ministry of Ayush, Government of India. Thank you very much, Professor Acharya, for being with us and sharing the research perspective and how the industry could actually collaborate and work. And I think Arvindji from Shri Shri Tattva definitely made a very positive remarks or a positive signal towards joint research. I'd like to thank Shri Arvind Vachaswiji in absentia because he had to leave, the Managing Director of Shri Shri Tattva, for indeed a very fruitful session. And I'd like to thank Dr. S. Rajgopal, Associate Professor and Head, All India Institute of Ayurveda, Ministry of Ayush, Government of India. My heartfelt thanks to our President, Shri Pradeep Multani, for motivating us and for being here for kickstarting the session. I'd like to thank Dr. Rajiv Rai for guiding us to have such sessions and many more such sessions as we go along on Ayurveda. My thanks also goes to the other two gentlemen on the screen, Dr. Ravi Rathod and of course Mr. Amit Patwal, who have helped put this program together and worked pretty hard. I know there were some challenges today because of WebEx, and there were a lot of attendees also who faced problems in joining the webinar today. So with the promise that we'll come back to you soon, and this time with Zoom, I would like to just have some closing remarks from our chair, Dr. Rajiv Rai.
So thank you, Vivek-ji, and I once again will like to convey my thanks to all the eminent speakers and the participants, and hope it was very informative, and it was informative for especially informative for our attendees, and we will like to meet again with a new concept and with a new topic very soon, and I will expect the participation from my eminent speaker once again, and I convey my a lot of thanks and welcome to Dr. Ravi Narayan Acharya ji, because he has also joined his new responsibility with the CCRS. So I convey my thanks and all the welcome for his new responsibilities. And once again, namaste and thanks to all. Thank you.
Thank you. Thank you very much.
Thank you, sir.
Thank you.
Thank you, sir.
Very much.
Ravi,
Yes, sir.
you can end the session, I think.
Yes, sir. मैं एक्चुअली वो चेक कर रहा हूँ कि इसमें रिकॉर्डिंग स्टॉप का,
Okay.
बट आई थिंक वो ऑटो हो जाएगा.
All right. You can double check with IT.
पहले आईटी से डबल चेक कर लेना फोन करके, वरना मैं यहाँ से ऑफ कर दूँ.
को नहीं है ना